Hello everyone, welcome to today's lesson with Aleb Mlunga. Today we're looking at a condition in mental health called mania. So mania is one of the conditions that we find, sometimes we'd find it in a condition called bipolar disorder, or sometimes in this particular situation, it is a standalone condition. So mania can be defined as a condition in which there a condition in which there is periods of abnormally elevated changes in mood and emotions, high energy levels, and high activity levels. So we have a person who has abnormally elevated moods or emotions with also high levels of energy and activity. So many are the times that we see people who are always hyperactive, who are always talkative, who have all this energy. And we are not saying those are people with mania, no. But a person with mania will present with such signs and symptoms. So we have to keep that in mind as we start looking at the nursing care plan. So this nursing care plan will have about 5 to 6 problems, but as we know, in an exam or in a test, we use 5 problems. So without wasting much of our time, let's get right into it. So we first do an assessment. So in mental health, it is very different from medicine or pediatrics or surgery even. In this patient, one of the most important problems that we can identify is risk for injury to self or others. And I know you might think to yourself, why are we starting with a risk in a patient? This is mental health. And the other thing is, this person has to be put in a safe environment to prevent an injury to self and others. That is why in nursing care plans to do with aggression or that has conditions that have aggression, you have to first prioritize the safety of yourself and others. So quickly, let's look at the problem, which is the first one, which is risk of injury to self and others. The nursing diagnosis is risk for injury to self and others related to increased agitation and lack of control over purposeless and potentially injurious movements secondary to extreme hyperactivity. So what we are just saying here is that the risk of infection or the risk for injury rather to self or others is related to extreme hyperactivity that you find in patients with mania. The goal is to prevent physical injury throughout hospitalization. So we do not want this person to injure either themselves or others throughout hospitalization. Let's look at the goals. Number one, I will remove all injurious objects from the patient's room to prevent injury. So you are going to remove any substances or any objects such as drip stands, curtains, curtain rails, anything of that sort. Number two, I'll put this patient in seclusion when the patient becomes violent to prevent injury to others. Number three, I will administer tranquilizers such as haloperidol to quickly relieve agitation. So as you can see, we have quite a number, but we just need 4. So the other one is I will stay with the patient and offer support to provide a feeling of security. And lastly, I will reduce environmental stimuli such as noise, lighting that may agitate the patient and therefore cause violence. So basically here we are simply saying I'll provide quiet environment and environment with soft lighting to prevent unnecessary stimulation of the patient and prevent um, injury to self or others. Evaluation. Patient safety maintained throughout hospitalization, evidenced by patient exhibiting no physical injury obtained while experiencing hyperactive behavior. So we're simply saying the patient's safety has been maintained throughout hospitalization, evidenced by a patient having no physical injury or causing no injury to self or others during the period of hyperactivity. The second thing is you find that in patients who are hyperactive, they do not have time to eat. So they are always running about, they're always talking, they're always moving. Liken it to a child. A child will always be running, playing, and they will not think about eating. So you find that in these patients, they will have imbalanced nutritional status or imbalanced nutrition less than body requirement. So that is our second problem. For nursing diagnosis, imbalanced nutrition less than body requirement related to patients' inability to sit long enough to eat meals, secondary to extreme hyperactivity, evidenced by loss of weight. So like we said, this person is extremely hyperactive, therefore they will not have time to sit and eat. And let me clarify this, on the go, goals start with two, but in nursing, we can even start with a client or client to be relieved of this. So in this case, we're saying to improve the nutritional status throughout hospitalization, but we can also put the goal as client will have an improved nutritional status throughout hospitalization. Let's just look at the interventions. Number one, I'll provide the client with high nutritional finger meals and drinks. So let's just say I'll provide the client with high nutritious meals and drinks that can be consumed while the patient is running to ensure that the patient is eating, and this will help to improve the nutritional state. So we can give these patients small foods that they can eat even when they are running. For example, you see in babies, we give jiggies, they can eat those small snacks. So we can do that even in hyperactive patients. We can give them soft drinks or drinks that are easy to eat, okay, rather than giving them just in shima that they have to sit in order to eat. Number two, I will maintain adequate records of feeding patterns um, to note if the patient's feeding is improving. Number three, I will weigh the patient daily to assess the nutritional status. Number four, I will determine the patient's favorite food and ensure that they are provided to improve the nutritional status, or you can say to improve appetite and therefore improve the nutritional status. So there are quite a number of points. We can also talk about administration of vitamins and mineral supplements to improve the nutritional status. Evaluation. Patient's nutritional status improved throughout hospitalization, evidenced by patient gaining and maintaining weight during hospitalization, and patients being able to verbalize the importance of good nutrition. So those are just quite a number of evidences that is put there. But we have to understand that this patient's nutritional status has been improved, and it can be evidenced by weight gain and the patient maintaining a good weight. Third problem, So we have impaired social interaction. Impaired social interaction. This person will not be having adequate or healthy relationships with people because of their distorted thought process. Remember, in this patient, there is increase of dopamine. And because of that, there will be disturbed thinking or thought processing. Therefore, they cannot or they will be failing to have good relationships with others. That is why we're having a problem called impaired social interactions. So the nursing diagnosis, impaired social interactions related to disturbed thought processes evidenced by discomfort in social situations, or you can say evidenced by poor social relations. Go to demonstrate use of appropriate interaction skills throughout the hospitalization. So we want this patient to show that they have these good interaction skills throughout hospitalization. Or you can say to improve social interaction throughout hospitalization. That can also be a goal. Interventions. Number one, I will set limits on manipulative behaviors and explain to the client what you expect and what the consequences are if the patient's limits are violated to create awareness. So I will explain to the patient what is expected of them and the consequences of not doing those things to just create awareness. Number two, I will avoid arguing, bargaining, or reasoning with the client. Instead, follow through with consequences if limits are violated to ensure for success of the interventions. So if this patient does something that is manipulative in nature, I will follow through with the consequences that we said are going to follow. So if this is going to work out, we have to ensure that we implement. Number three, I will provide positive reinforcement for non-manipulative behavior to motivate good behavior in the patient. And then number four, we can say, I will help the patient identify positive aspects about self, recognize accomplishments, and feel good about them to stop patient from manipulating others for self-gratification. So you find that these people would want to manipulate others so that they can feel good about themselves. But if you help them to identify those positive aspects about them, you find that they can refrain from finding gratification or pleasure in manipulating others. And the last one here, we can say help client recognize consequences of own behavior and refrain from attributing them to others to promote awareness. So there are quite a number of things here you can talk about. You can talk to the patient, educate the patient on the importance of social interactions to promote good relations, to promote understanding. So all those things can be interventions. Evaluation. Patient's interaction with others improved, evidenced by patient relating well with others without manipulating them for self-gratification. Fourth problem. So we have patients who are running about, they have too much energy. So as we see, one of the reasons why children don't sleep during the day is because they keep on running around. They have too much energy. So in these patients, you find that because of the hyperactivity, because of the elevated energy levels, they cannot sleep. So this is insomnia. So insomnia can also be termed as impaired sleeping pattern. Then you put insomnia in brackets. Impaired sleeping patterns. So the nursing diagnosis is impaired sleeping pattern or insomnia related to excessive hyperactivity, evidenced by pacing in the room or moving around in the room during sleeping hours. Go. So this is what I was talking about in terms of the go. So patient will be able to acquire 6 to 8 hours of uninterrupted sleep within 6 hours, 6 weeks of 1 week of hospitalization. We're saying patient will be able to acquire 6 to 8 weeks of uninterrupted sleep within 1 week of hospitalization, or you can say throughout hospitalization. So here we can say we just want the patient to have normal uninterrupted sleep. Let us look at the interventions. So number one, I will provide a quiet environment to avoid stimulation or to reduce the levels of stimulation so that we promote sleep. Number two, I'll monitor the sleeping patterns to note the interventions to implement. Number three, I will structure schedules for activities that includes sleeping time and time to play to promote rest and therefore promote sleep. So basically this point can also be phrased as I will ensure that the patient performs activities during the day so that they can sleep during the night. So other interventions that we can put here is I'll prohibit or restrict the patient from taking caffeinated drinks such as tea, coffee, and others during bedtime to promote rest and sleep. So what these drinks do, they stimulate the nervous system. And when the nervous system, the central nervous system is stimulated, that will interrupt with the sleeping pattern. The other thing that we can do here is administer sedatives as ordered to assist the patient to achieve sleep. The other thing that we can do is I'll provide nursing measures that promote sleep, such as rubbing of the back, advising the patient to take a bath so as to relax them, and this will promote a rest. So promoting, advising the patient to take a warm bath, okay, to do a back rub, to play soft music. All these things help to promote a rest. Evaluation. The patient's sleeping pattern improved, evidenced by patient's ability to fall asleep for 6 to 8 hours per night without medication. Okay, we move to the fifth problem, which is disturbed sensory perception. So because of the distorted sleeping pattern, you find that people will start seeing things. So disturbed sensory perception related to sleep deprivation, evidenced by hallucinations. Go. Patient will be able to define and test reality, eliminate the occurrence of sensory misinterpretation within the first 72 hours of hospitalization. What do we mean here? We're simply saying that the patient will be able to say this is reality and eliminate sensory misperceptions within 72 hours. So what we just want to do is the patient to define or recognize reality and eliminate the sensory misperceptions within 72 hours. Okay, let's look at the interventions that we're going to implement. Number one, observe client for signs of hallucinations such as laughing or talking to self and intervene early or for early intervention. Number two, I will avoid touching the patient before warning him or her that you are able to do so, as the client may perceive a touch as a threat and respond in an aggressive manner. Number three, I will accept, okay, so we are going to put it like this. I will portray an attitude of acceptance to encourage the patient to share the content of hallucination with you in order to prevent injury to the client or others from command hallucinations. So what this point is just saying is you have to be able to create a relationship in which this patient tells you the hallucinations they're having. How do you do this? By showing them that you are able to listen or you're willing to listen, not just discarding the fact that the hallucinations and telling them this is not right, this is not there. But we are not saying reinforce the hallucinations, no. We are saying you have to show an attitude of acceptance so that the patient can open up to you. Okay, the other point is I will avoid reinforcing the hallucinations. I will avoid reinforcing the hallucinations. Therefore, I will avoid reinforcing the hallucinations that the patient is having, which will help to reinforce reality, which will help to make the patient aware of the reality. So do not reinforce hallucinations. No, there is a snake. Tell them, no, there is no snake. What you're doing is you are avoiding to reinforce the hallucinations, and that will help to reinforce reality in the patient. Then the last point is I will try to distract the patient away from misconceptions by involving the patient in interpersonal activities and explain the actual situation to bring the patient back to reality. So we have to at least try to distract the patient by involving them in activities and explain the reality to enforce reality. Evaluation. The patient's sensory perception normalized, evidenced by patient's ability to differentiate between reality and unrealistic events or situations. Okay, let's look at the last problem. The last problem is self-care deficit. This person will not have time to care for themselves. They are too busy moving around and they cannot think straight. So self-care deficit related to cognitive impairment, evidenced by patient looking untidy or unkempt. Go. Patient will maintain good personal hygiene throughout hospitalization. Patient will maintain good personal hygiene throughout hospitalization. Interventions. Encourage the patient to bath and supervise them. during baths to promote self-care or hygiene. I'll encourage the patient to wash his or her clothes when dirty to promote hygiene. Number 3, I'll encourage the patient to brush teeth every day or every after each meal, prevent halitosis or oral hygiene. The other point is I'll encourage and supervise the patient to maintain hair to promote the personal hygiene. So we are just saying there's oral care, hair care, there's also bathing. You can also put nail care here. You can also assist the patient to make a bed. All those things can help. Okay, the evaluation is the patient's hygienic status has been improved, evidenced by patient looking smart all the time or kept clean. Okay, so those are the problems that we managed to come up with and the interventions. Basically, that is our nursing care plan for Mania. So don't forget to like, subscribe, and share the video. And also, you can comment in the comment section other problems that you might have under Mania, and also other conditions that you may want to see on the channel. Thank you for watching. God bless you.